Dr. Cromwell, the floor is yours. Thank you.
Thank you very much. I'd like to thank the Ethnic Health Initiative for inviting me to speak here today. I've attended the initiative's conferences in the past and found them stimulating and interesting, and when I received an invitation to speak, I felt honoured and privileged, and so I extend my thanks. And I thank all of you for being here this morning to listen to what I have to say. I come into this arena from the position of experience as a hypnotherapist. I'm not a psychiatrist, and I'm not a clinical psychologist. I'm a hypnotherapist. And it was about 14 years ago that I began to encounter cases that defied the conceptual framework that I was familiar with in treating people with emotional disorders. So I had to go away and research and learn about how to deal with these things. And I discovered, to my amazement and against my beliefs, the phenomenon of spirit possession. And it took me a long time to accommodate this idea because of the conditioning that we receive in Western society to disbelieve these things. Now, I have no practical experience in dealing with spirit possession with ethnic groups. All my clients, my patients, have been white British. So I want to address the idea that was suggested by Dr. Sashi. His wonderful presentation raised an enormous number of questions that need answering, and I hope that I'll be able to present to you ideas to address those questions and answer them in time from a research protocol. The universality of mental illness proposed by Emil Kraepelin, and the idea that spirit possession, in contrast with that, is culturally specific. What I'd like to suggest is that the interpretation and the personal narratives that give meaning to these phenomena are culturally specific. But I'd like to suggest to you, and my experience teaches me this, that spirit possession is universal. It doesn't matter what culture or ethnic group or society you come from, we are all, and I include myself here, susceptible to spirit influence, benign and destructive. So I have personal experience of encountering spirits within my clients, and I have personal experience of coming under attack myself from demonic forces. So I speak not just as a practitioner, but as an experiencer. And what I'd like to do to begin with, just so that I have an idea of who I'm speaking to, I'd like to get just a rough idea of the composition of this audience. So I'm going to ask you just to raise your hand. I'm recording this, but the camera is not focused on the audience, so you'll not be identified, you'll just be counted, okay? I just need to know how many of you are involved in the practice of dealing with spirit possession. You have clients, you're either a shaman or a psychiatrist. Just give me an idea of how many. Quite a few. I'm just going to do a quick count. 1, 2, 3. About 20, rough count, about 20 of you. Okay. So practitioners, 20. Now, how many of you are involved in helping others learn about these phenomena? How many of you are not just educators, but involved in training people in how to deal with these problems? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Roughly 10. And how many of you are just researchers? I say just, I mean, principally your work is involved in research. You're either a student or a PhD student or involved in research of any kind in order to try and understand these principles. How many of you are researchers? 1, 2, 3, 4, 7, 8, 9, 10, 12. About 12 of you. Okay. Now, how many of you have had personal experience of spirit possession yourself? 1, 2, 3, 4, 5, 6. Okay. So that gives me a good idea of who I'm speaking to and how to address it. Now, what I'm going to be talking about is the practical integration of education, research and clinical practice. So how many of you are already integrated as clinical practitioners or spiritual practitioners, researchers and trainers? How many of you do all three? 1, 2. I can see one that hasn't put his hand up, so I'm going to count 3. Okay, so 3 of you have...
Sorry, I think the question wasn't very clear.
Okay, how many of you are involved in practice at helping people with spirit entities? And also helping to train others in the principles and also contribute to research. Okay, let me make this clear. Contributing to research, how many of you practice and teach and have published research papers? No. Okay, good. So we have a 0 for that. And this is what I want to address: integrating clinical practice with training and published research. So we're at ground 0. This is the platform.
Can we go up? Yeah.
We can only go up. Dr. Shati mentioned epidemiological studies in other countries. Where was it? Mozambique, I think you mentioned?
Correct.
What I'm proposing is an epidemiological study in this country, in London. And the idea is a very simple one, really. It just needs coordinating. Now, the initiative for this was proposed in 2006 by an independent researcher, Eleanor Stobart. I was hoping Eleanor was going to... are you here, Eleanor? No, I was hoping she could get here.
Can you spell the surname? Sorry.
Stobart. Stobeart, Eleanor Stobart, 2006. She was commissioned by the Department of Education to research into this problem with reports of serious child abuse. The case of Victoria Climbié, you may recall, and Baby P, where people in ethnic minority groups believed children to be possessed and by witchcraft, and there were serious cases of child abuse and murder. So this was this initiated research, and Stobart made several recommendations that were taken up by government, and government introduced set up a working party that comprised of several interested groups. Now, as I read out the names of these groups, if you belong to any of these groups, just raise your hand so that I can get an idea of which groups are represented here. Afruca. Afruca. A-F-R-U-C-A. 1? Okay. That's Africans Unite Against Child Abuse. Yeah? Okay. 1. The Association of Directors of Children's Services. No. Coordinated action against domestic abuse? No? Children and families across borders? The Church's Child Protection Advisory Service. It's a Christian organisation. Anyone from that group here? No. Churches Together in England. No. These are all member organisations of the government initiative to tackle this problem. Okay. The Department for Education. Anyone from Department of Education here? No. The Congolese Family Centre. No. The Home Office. No. London Safeguarding Children. The London Safeguarding Children Board. Yes? Okay. Metropolitan Police. Anyone from police here? No. NSPCC. Anyone from NSPCC here? No. The Peace Alliance? No. Peace International? No. Trust for London. This is a very important group, Trust for London, because they provide research funding. The Victoria Climbié Foundation. Anyone from the Victoria Climbié Foundation present here today? Sounds like a roll call, doesn't it? No. So these are the principal organisations that make up the government's working group to tackle inappropriate methods of spirit possession intervention that cause harm to children. That's the initiative. And of those groups, we have one person here. And the first thing I'd like to suggest is that the Ethnic Health Initiative, as an organisation, as a group, becomes party to this government initiative. I think that's very important. At the end of Dr. Shashi's presentation, 4 questions remained on the board. The implications. How common is spirit possession? As I've already suggested, in my experience, is a universal principle. People who have no belief in spirits can be affected by spirits without their awareness. How best to deal with spirit possession? What is a course for best practice? This is what my idea, my research proposal aims at. How can we adapt clinical practice and collaborative working between shamanic healers, religious practitioners, psychiatry, clinical psychologists and so on.